and thank you all for joining. We have 400 people registered, although they're not all people. Many of them are departments of health. So we know that there are many people who are going to be sort of sharing, and we have a very large audience for this webinar. So we're very excited about that. And you'll see we have a few panelists on the screen here. We are going to introduce those panelists as we go along. Kim-Marie Bogg, Dr. Bogg, and Doris from the CDC. And then on our team, besides myself, we have Mariah, who's responsible for all of the operations here, and Laura, who is like one of the directors at CHAMPS. So we have a full team in, as well as all our team who are online. So I will get started at this point. So welcome everyone to the webinar. The webinar is being recorded. If you have questions during the webinar, please type them into the chat. If you type them into Q&A, it's fine. We're monitoring both. I'm just sort of one of those older-fashioned people who can't quite deal with two methods. But anyway, either the chat or Q&A is fine. At the end of the presentation, which is probably going to be about 35 minutes long, we'll have plenty of time for questions. So please go ahead and type any questions in there. And also feel free to introduce yourselves in the chat if you want to sort of say hi to other people, so we know who's online. That is fine. We have got your information because you are registered, but I'm happy for people to say hi and, maybe spot some of your friends and colleagues that way and have a chat while we're speaking. So this webinar is about CHAMPS National, a newly launched program to improve maternity care practice and breastfeeding support in the hospital. And blank slide. So this is the webinar you're on. We're going to talk, first of all, a little bit about CHEER and CHAMPS National, just as an introduction. I know that many of you do know who we are, but there will be many people who don't know who we are. So we're going to talk a little bit about the background, what the CHAMPS National program is going to be about, give you a little bit of background about the philosophy and the way that CHAMPS functions, and then tell you how to join the fun. And just for FYI, there were 400 people registered, and not that we're ever competitive at CHAMPS, but we do have, guess which state has got the most? Texas. We have 40 people or 40 entities registered from Texas. And then in second place is New York. Third place is Alabama and California. And we have lots of people registered from Massachusetts, but I didn't want to cheat because all of us are in Massachusetts. So that's also a high number. But anyway, we have loads of people from those states and many other states. And hello, West Virginia, because we have 14 people registered from West Virginia as well, and a bunch of people from Ohio. So thank you all and welcome, because we're really excited that we're going to be able to work with so many different areas of the country. So I'm Anne. I'm the director of the CHEER program. CHEER is the Center for Health, Equity, Education and Research, and we're based at the Boston Medical Center and the Boston University School of Medicine. And Boston Medical Center is the teaching hospital for Boston University. And actually, BMC was the first baby-friendly hospital in Massachusetts back in 1999, and I was there and I was part of that effort. So I've been hanging around in BMC and baby-friendly for quite a while. We do have national and international partners. We have Cheering, which is another program that I run in Athens, Greece, working with refugees. And our funding at the moment, for disclosure, is from the CDC for this program, the W. Kellogg Foundation, the Bauer Foundation, which is based in Mississippi, the FC Barcelona Foundation, and the Linda Norgrove Foundation. And this is our very diverse team across the world, across the country and across the world. We pride ourselves on equity and the proactive attempt to bring in people from all of the communities that we represent. So in fact, we've also brought a few more people in recent weeks into CHEER who haven't quite made it onto this slide because they're new hires, but this is our bigger picture view of all the people that work with us as consultants and collaborators across the world. With regard to this particular program, CHAMPS National is a cooperative agreement between Boston Medical Center and the CDC. It is one of several different equity and maternal child health programs that CHIA runs at Boston Medical Center. And this particular one is a 3-year project. It's our biggest program. And year one runs from September 30th, 2023 to the end of September 2024. And most of the focus today will be about this year and the beginning and the launch. So I'm just going to turn it over briefly to Doris, who is our program representative at the CDC, to introduce herself.
Hi, everybody, and welcome to today's webinar. I'm really excited to be here with you, and I was very pleased to see such a strong interest in this program at this initial startup point. Very excited to see hospitals and health departments from across the nation, including our territories, Puerto Rico. So thank you all for being here. And on behalf of the CDC's Division of Nutrition, Physical Activity, and Obesity, I'd like to thank you for your interest in this project. We recognize the important role that hospitals play in helping families start and continue breastfeeding, and we really do applaud you for your interest in this important work. I've known Anne and Kim Marie Bug for a number of years, and Laura, and I know your efforts are going to be supported by a well-qualified and experienced team under their leadership. Anne and Laura from Boston Medical Center and Dr. Kim Marie Bug from Reaching Our Sisters Everywhere. You're also going to have access to training and technical assistance that is being provided by leading national experts in quality improvement, breastfeeding support, and lactation science. I hope that by participating in this webinar and learning more about the initiative, you'll have all the information you need to talk about it, your participation with your hospital leaders, your healthcare providers, and your maternity staff, and decide if now is the time for your hospital to undertake this quality improvement work. So again, thank you for your interest in being here today, and we wish you the very best if you pursue this opportunity. Thanks, Anne.
Thank you very much, Doris. Thanks for that great introduction, and thank you for putting your faith in our teams. This is the CHAMPS team in Boston. I'm showing you this slide because many of you have already started to correspond with us, and we have an ever-growing team in Boston. So when you hear back from somebody, these will be the people you hear back from. Doug and I have worked together in Boston for over 30 years. Laura has been with us for many, many years. I haven't lost track, but many years. And then we have a great team of young, enthusiastic people helping us as well. So this is our Boston team. And again, all of this is recorded. So however you want to go back and look at who was on here, you'll be able to see this. And then this is our national team for the moment, the CHAMPS national team. So all of these people, many of whom are on the webinar right now, are actually part of the team. Like they're going to be consulting or contracted with us. The contracts are still being finalized, but right now they are on our list of people that will be working with us. And you can see, I have to admit, I know there's not an awful lot in the middle of the country there, but most of these people and groups already have national reach. So don't worry where they're actually, I mean, we have targeted, we have a lot of people in the South because we really want to target the South. But many of the other people already work nationally, like Kim Marie at Rose. So, and Cami, many of you will recognize Cami out there in the top left in Seattle. She is a Native American and is one of the leaders in the country for Native America. And we did not forget the territory. So we have Puerto Rico and Guam in here as well. And we have representation in both of those places to reach the area around that, their islands and their locations. So I'm going to turn it over a little bit to Kim here just to introduce herself and the Rose program, as the Rose is our main collaborating partner. Thanks.
Good afternoon, everyone, and please allow me to give a shout out to Guam because it is 2 a.m. in the morning, and I noticed in the chat there is someone there, and I know here from there, and I know because my daughter is in Guam working for the DOD, so Guam and Puerto Rico, we're so excited that the territories are here too. My name's Kim Marie Bug, and I am with Reaching Our Sisters Everywhere, and we're based in the Atlanta, Georgia area. And our mission is to address breastfeeding disparities for communities of color. We have had the opportunity to work also with several projects, baby-friendly projects. I actually worked with Minda Lazaroff, who was the first director of Baby Friendly many years ago, to do some hospital assessments, and also had the opportunity to visit the Philippines in the very first Baby Friendly hospital, which definitely won my heart forever. So this is a wonderful project, of course, that makes a real difference for marginalized communities. And we are so excited about that. And also just so honored to work with this extremely diverse team of experts. We have learned in the several projects that we've worked with, Ann and I together, sort of best practices, and we really took to heart the lessons that we learned with each one that we've done to make the next one definitely level up and much better than the one before. So we are so excited to bring all of those quality improvement lessons learned to this space also. And so one of the things that we always do is work specifically from the very beginning with community to help them to understand what's going on in the hospitals, so that when they are in the hospitals, that they have an idea of what is being done and how it should be done. And that's always been very important to this perspective. So there are many people that work with Rose that are on this webinar also, and we are really excited to be here. So thank you so much, CDC, for choosing this project to do this, because we think that it is going to really make another huge difference. So thank you all so much.
Thanks, Kim. My sort of sentinel memory working with Kim was when we were in New Orleans together at the beginning of the CHAMPS South project, and we were sitting in a car park outside a very big hospital, having tried very hard to digest everything we'd been seeing all day, and we were both just looking at each other thinking, I really know what we're doing here. And we've come a very long way from that first time, which is, no, it wasn't the very first time I met Kim, but it was the first time we worked on location together. So it's really great to be able to work with Kim and to have Rose and all their team and their extensive network across the country on the program. So thank you, Kim. So what exactly is this program? So it's a cooperative agreement, which is a special kind of agreement. It's not exactly a grant, like it's not like they give us the money from the CDC and say, okay, off you go and so do what you can. It's like a collaborative work. So the CDC is very much involved with the work. And the emphasis on the program is narrowing the gap between black and white breastfeeding rates, or rates of families who don't normally breastfeed or don't breastfeed to the same extent as some other families. So we are trying to narrow the gap in those areas between advantaged and disadvantaged populations. There have been 2 cohorts that the CDC has funded in a similar manner before. The first one was Best Fed Beginnings at NICHQ in 2011, and Kim and I were both working on that, as were several of the other people on the webinar and who are consultants, Dr. Laurie Feldman-Winter, Jennifer Usianov, and I'm sure there's going to be others and you should never name because you'll forget, but many of us were working on that collaborative together. So we bring from that collaborative a lot of lessons learned, as Kim said, to this one. And then there was also the Empower Best Practices, which is another similar collaborative in 2014. So the CDC's done this before, but each time it's done in a slightly different manner with a slightly different focus. The goals of this specific program will be to enroll 100 hospitals across the US and the territories. That's our first job. So that's kind of why you're all here today, to talk to you about that. And then we will be training clinicians at those hospitals on safe, equitable, and evidence-based breastfeeding supportive maternity care with cultural humanity and QI. It's a lot to say, but that's what we're going to be doing. It's all equally important, and we're really into the cultural humanity and the equity, and we really want to focus on disadvantaged populations, which is often geographic as well. And so we're so thrilled to see so many folks from some of the regions where they haven't had as much support in the past. Once we get those 100 hospitals enrolled, we want to increase the evidence-based care that is going to the families and lactating people. And also increase breastfeeding initiation. And we have some specific goals which we hope to make. And I'm going to talk about some of the things we did in Mississippi to show you what we can do if things go right for everybody. And then long-term goals are to increase breastfeeding rates of infants at higher risk of not breastfeeding and reduce racial and ethnic disparities in breastfeeding information in initiation. The basis of all of the work we are going to be doing is the 10 steps to successful breastfeeding. This is the evidence-based pillars of breastfeeding support in the hospital. The WHO created this in 1991. The most recent revision, which we will be working on, is 2018. These are the 10 steps pictorially from 2018. And this is the resource, the 2018 Baby Friendly Hospital Initiative. I don't like to say it as if it's new, because it's not new. It's been around now for some time. I am actually working with the WHO on some guidance for this as a consultant for this work as well. So it's going on at all levels, nationally, internationally, in all countries, and at the WHO level. So not to be flippant, but if you haven't heard of the Baby Friendly Hospital Initiative, or if you haven't heard of the 10 steps, this is the link, because I'm not going to spend a great deal of this time speaking about it, because I know that many people have already heard of it. And this is kind of the nuts and bolts of what we do. So I have given you that resource there if you would like to look at it. And also the information on our website. And there's many places you can look up about Baby Friendly if you don't already have the information. And I know many of you will have. So from CHAMPS's perspective, we have had several programs under the name of CHAMPS, Communities and Hospitals Advancing Maternity Practices. We have worked primarily in communities with high rates of infant and maternal morbidity and mortality and significant health disparity and low breastfeeding rates. So the one on the left here of my screen is AIAN CHAMPS. That was working with American Indian, Alaskan Native populations between 2011 and 2018. We also worked collaboratively with the Indian Health Service and over 10 different tribes with their own tribal hospitals that were not federally IHS sites. And all the 13 of the IHS federal sites were baby friendly designated under that program, and many tribal hospitals as well. So that was one of our early ones, and we learned a lot of lessons there. Many thanks to some of our collaborators. I know Antoinette, who is from Guam, was actually working at Shiprock Hospital on Navajo Nation during this period, and she was our lead there. So when we heard she'd moved back to her native Guam, we grabbed her immediately and said, Antoinette, we're going to have a new project. She said, oh no, not a new project. No, I don't have time. But she's definitely signed up for it. So I hope she made it onto this webinar. And we're delighted to have Antoinette, who's very experienced. I think that speaks to many of the people we're collaborating with. Hello, Antoinette, I see you there. Many of the people we are collaborating with who are, really experienced in this field from other programs as well. CHAMPS South spanned 33 hospitals in New Orleans, Tennessee, Texas, and Mississippi. That was funded by the Kellogg Foundation. I know that New Orleans is not a state. It was just funded by Kellogg because that's one of their areas of focus. So we did a lot of work. And actually during that program, every hospital in Greater New Orleans became baby friendly designated as well. And then the Mississippi CHAMPS program is perhaps what we're the best known for. That is still ongoing. We launched that it was originally Mississippi was part of CHAMPS South and then became an entity in its own right. Despite at the beginning not hearing very much from Mississippi, within a couple of years they were like the main adopters of this whole program, and we've had huge success, or they've had huge success in Mississippi with the CHAMPS methodology and the catalyst impact it's had, and the input from Rose and the community. I would like to say the WIC officers in Mississippi, the state in Mississippi, the Bauer Foundation. We have had a huge effort from the people who live there and work there to work with us. We've just sort of paved the way in a way, but 36 of the hospitals in Mississippi, and there were about 40 of them total, signed up with the program, and 29 of them have gained baby friendly designation. So that for us was a tremendous success, and it was a great step for Mississippi. And when we launched Mississippi CHAMPS a few years ago, we had a meeting of us guys in the team, and we all said, what we want the headline to be for Mississippi, if we could predict. And one of the people said Mississippi #1, and we all sort of laughed. But actually, apart from Rhode Island, And Rhode Island, love you, but you're very small and you only have 4 hospitals. Apart from Rhode Island, Mississippi now has the highest number of baby-friendly hospitals in the country, and the highest proportion of baby-friendly hospitals in the country. So I think it's proportion, not number, but it's huge. So really, hooray, Mississippi, you're number 2 to Rhode Island, so kind of number 1 in the big picture. And we're just delighted that Mississippi has done so well and really helped us. And I know there were many people registered from Mississippi for this webinar. You've helped CHAMPS to get here because it's because of all your hard work that we've all together had this success. I'm going to show you a little bit of the data from Mississippi, but I will just sort of explain it first. We do work with hospitals to monitor their progress at the facility level. Step 1C of the 2018 10 steps says that hospitals must establish ongoing monitoring and data management systems. And that is what we help you to do. That is now one of the requirements to meet with the 10 steps. So we help you to do that. And don't worry, we really do help. We were, I won't name any hospitals, but there were hospitals where we were going and teaching people to use Excel and helping them with extraction from the medical record, helping them to put fields into the medical record so that you could actually track things like skin to skin, because the fields weren't even in the medical record, and by race, so we can see gaps and changes and improvements. And we traditionally in CHAMPS, we focus on key indicators of the 10 steps. We don't make people collect data on all 10, because if they did, there's one of the things we learned early on. If people are asked to collect data on all 10 steps, they don't collect data on anything. So we are only collecting traditionally breastfeeding rates, skin to skin, and rooming in rates, which we have found in the hospitals we work with is doable, and it's very nice because people can track their progress. So we will do this as part of our CHAMPS national program. So these are some data from Mississippi. It's the axis at the y-axis, it shows it in months rather than years. But over the course of the program, for the hospitals that return data to us, which is almost everybody, we have seen a rise in the skin-to-skin vaginal rate from an average of about 30% to about 90%. And we have put onto these charts the black and the white rates because those are the 2 biggest racial groups in Mississippi. And we wanted to chart any changes in disparities during that process. So you can see that that's pretty dramatic. It's pretty dramatic, and I assure you that this is not made up. Like, there is no way. We are really careful with the hospitals. We do sampling, we get them into the medical record. A lot of places at the beginning don't really know how to define some of these terms. They say skin to skin, yeah, the baby went 10 minutes with mom, so they got skin to skin, but no, actually, you know, baby friendly says it has to be an hour full skin to skin. Medical and safety issues, you know, coming into that, but the definition is an hour of skin to skin post birth, and that is what you're seeing. This is the full blown. This is the real thing. It is not. It really, we God love you hospitals in Mississippi, because you've worked hard on this too, and I know that at the beginning there was a lot of frustration and angst because people actually thought that they were doing some of these practices and they weren't. So you can see we've had a big mutual impact with the hospitals. And similarly with rooming in. Rooming in has gone up from around about 20% to over 80. 80% is what is considered to be compliance with Baby Friendly USA, and also at the international level, the sort of benchmark for being in compliance with the 10 steps or adhering to the 10 steps is 80%. That's what is given as the pass mark, if you like. So that's why perhaps everybody got there. And, you know, there's always reasons why you can't do the last 10%. I mean, reasons that are very valid and things. So that's the rooming in rate. And this means 24-hour rooming in with the baby and the mom. So yes, the babies go out for medical treatment. Yes. So we'll get into all of this with the hospitals as you sign up. But this is real rooming in. This is not 1 hour a day in the room with the mom. And then the initiation rate. So these also have gone up, and they've gone up significantly, and the gap has closed. You can see obviously that the increases have not been as dramatic as the ones in the practices. I was going to say it's easy to change practice. It's definitely not easy to change practice, but it's tangible. It's tangible. You can work on it. You can educate your staff. You can do things to help those things happen in the hospital. But then your breastfeeding rates, it's just sort of pray then, it's not quite teach and pray. We don't believe in teach and pray, go and teach them and hope it happens, because that doesn't work. You have to do more than teach. But it certainly is, those evidence-based practices, if you're doing them, then the initiation rates and the exclusive rates should increase, and they have. And also the gap has decreased, and we've published several papers about this, and I think our papers are on the end of this presentation. But we significantly decreased the gap between the white and the black breastfeeding rates in both initiation and exclusive breastfeeding. And for those who are interested, we also analyzed WIC data from the area, and also I can't say we had a significant, I'm sure in this case, what you're looking at, the CHAMPS program as adopted by the hospitals, had a significant impact. We don't know if CHAMPS impacted the WIC rates, but the WIC rates at this period, during this period, also went up significantly in Mississippi relative to other states. With Nathan Nickel, who's also on here and has also worked forever for CHAMPS, has analysed that, and he did a very clever analysis, and we show that WIC rates went up as well. So we are quite happy with this progress that we've been able to monitor in Mississippi. So you've met Kim now. We have a couple of things that we've really felt have helped us in working with the American Indian hospitals, Alaska Native hospitals, and in Mississippi. When we worked with the IHS, the Indian Health Service, across the country, and the tribes, although obviously geographically there is a huge spread, everyone was working for a common cause. Like, people were on the same team. In fact, for the federal sites, people actually had the same medical record. At the different Indian Health Service hospitals, everyone had the same medical record. So when you talk about changing it, you actually had a system. People could compare, people could compete. I'm a little competitive. We do see competition, and that's great. We love it. I mean, even better actually than the competition among the hospitals is when everyone else sees it happening. And like, for example, the first hospital in Oklahoma, in the Dakotas, in many states, the first baby-friendly hospital was one of the Indian Health Service hospitals. And people from other hospitals where we were consulting and working would say, well, it's not possible. How can they do it? And we said, if they do it, you can do it, because some of these hospitals have the least resources. They're working with the most disadvantaged, highest morbidity patients. If they can do it, you can do it. And I would say the same thing for Mississippi. If Mississippi can do it, there is absolutely no state on this presentation that has an excuse not for doing it, because there's nobody facing bigger barriers than the Indian Health Service and Mississippi. So you can all do it. Within those groups, and you can tell that we all get very passionate. Mississippi also is a community. It's one state. Everyone's said to us many times, well, it's Mississippi versus Alabama, who's going to be at the bottom. We're going to do this. And so perhaps that's why we have so many people from Alabama on. But anyway, there was a community feeling, a push, a pride, just a great passion from the community. And it is difficult, because we know, because we work nationally as well, to have that passion when all of the hospitals are from different places and serving different populations and different kinds of hospitals, rural, urban, academic, different. So in order to try to recreate some of that passion, we have created, and we'll be speaking more about, the orbs, the organically related hubs, which you imagine an orb, and all the, sort of, I imagine some big golden globe or something. And each of the different groups that we want to have strong representation, the African American, the Indigenous, the territorial, and the Latinx groups, that we feel will really have their own passions and will unite. We want the orbs to unite them across the country. I know it's terribly different in Guam versus Puerto Rico. I'm aware, not personally aware, but I do know it's different. And I know it's different in Mississippi, and if you're African American in different parts of the country. And I know that the tribes and the Pacific Islanders are different, but there is a common purpose that we have been able to tap into in our other programs. And this is what we hope that orbs will do. They will unite people from across the country, from across the denominations, whether you're a doctor, whether you're a WIC person, whether you're a community organizer, whether you're a Department of Health, whether you're a nurse, there will be some shared interest in the orgs, and that is one of the things that we're really hoping to promote and fly with on this program. So with all of that said, what can you guys do? So we said that there's about 100 hospitals nationally, and we know that many of the groups that signed up were not just hospitals, they were also departments of health or community-based groups. We would like you, first of all, to reach out and tell the hospitals in your area to please apply. I'm going to talk about that process in a moment, but we will be basing it around the hospitals. So if no hospital from Alabama enrolls, then we won't be doing very much in Alabama. It's going to be based geographically around the hospitals that sign up. So please make sure that you reach out. The very first step will be to reach out and encourage hospitals to sign up for the program. We will identify and prioritize hospitals in geographic areas which have low breastfeeding rates. This may be microcosmic, it doesn't have to be statewide. It may be one or two hospitals in a particular state that have, serve areas with low breastfeeding rates, but we will be prioritizing those hospitals. We will enroll hospitals that have a high proportion of families that are less likely to breastfeed. And we have a form, an expression of interest form, which will be released this week, where we will send it out to everybody who's on register for the webinar and all of our consultants and colleagues across the country, that you can then forward on to hospitals in your region. So that's the sort of basis of enrollment that will be starting as soon as next week for people to sign up and find out how to actually become part of the initiative. One thing that my colleague Laura put this slide together, but one thing that we're quite proud of at CHAMPS is that as I talked about, we have the Indian Health Service system, we have the whole state of Mississippi. We work with different collaboratives like departments of health, community groups, and QI collaboratives. So in Mississippi, we work with the Department of Health. We really worked with WIC. We worked with different groups. Kim Marie's group did a lot of community-based education, community transformers for people living in the areas served by the hospitals. So we really want those people to help us, and QI collaborators as well. And so basically, once we get the hospitals enrolled, we will be looking to work with some of these systems so that, things are consistent and that everybody's aware. So for example, in Mississippi, we work very closely with WIC, and many of the WIC peer counselors came to the hospitals with us when we did site visits. And in some cases, this was the first time that the hospital realized who their WIC representative was through no fault of WIC. I'm just mentioning that. We did notice a few introductions. But this was, really a strong point. And now, there's a massive amount of collaboration between WIC and the hospitals in Mississippi. We also worked with insurance companies in Mississippi. Blue Cross and Blue Shield of Mississippi backed our initiative, not financially, but morally, let's say. They worked with us. They went with us to a lot of hospital site visits. They implemented their own framework for QI improvement and giving hospitals reason to work with them and to collaborate with Blue Cross and Blue Shield, and that made a huge difference. And we would love to get other entities like CMS and Medicaid involved with helping hospitals to improve once they are signed up. And we also work with several hospitals. So like we worked with the Oshner hospital system in the New Orleans and some of southern Mississippi areas. And that was great because, again, the Oshner system, I think they went through something like 23 versions of a policy, but eventually, maybe more, we won't scare anybody off with that. But eventually the entire Oshner system had the same breastfeeding policy. And that was really helpful for us. And that wasn't even just the hospitals that were enrolled in CHAMPS, but those hospitals, and there were several of them, got together and created a common policy for their system, etc. etc. The same can go for things like formula purchasing. Hot systems often get together, and bargain as a unit, etc. We had many of these groups work with us before. Merit Health in Mississippi, which is part of CHS nationally, and Christus Health in Texas, we had a lot of support from them. So thank you to those groups, and we really hope that we can, involve those groups once we have the hospital enrolled in helping the hospitals to meet some of the 10 steps and get, help them systemically to work on them. The WHO 2018 guidelines emphasize that there needs to be integration between facilities that are trying to meet the 10 steps, setting benchmarks, counting their data, doing all that thing. There needs to be integration between the hospitals, facilities, birthing facilities, and whichever regional entities are part of the healthcare system. So, for example, in England, the hospitals report out to the National Health Service. In Norway, mothers complete a form at the end of their stay talking about the 10 steps practices that goes direct to the Ministry of Health. There are some newly emerging cases of integration, and this is the big emphasis that the WHO is putting into this program at the moment. So that is one route that we would like to take, and that's another way that once we have the hospital signed up, they'll be able to work with entities that in their region that will be able to help them. And we also know that many of you are already recipients of the CDC's State Physical Activity and Nutrition Program, the SPAN program, and several of you have chosen to use the funding from that program to implement the 10 steps. So that's another way that we can work together. If the state has received funding and you're working on that, we can collaborate through the hospitals with the states. When I say collaborate, some examples like we speak at their conferences, people come to our conferences, we share information, we empathize, we share policy, we can just share things that are publicly available with other groups that are seeking to work together with the hospitals and make those connections for you. I think Kim will agree with me. I think that the reason that Mississippi CHAMPS is so successful is that we have the African American population behind us. And I don't see that being very common in public health systems in Mississippi. I don't see it's common. The population survey is always behind the initiative, but we feel we have that for CHAMPS. And we want that to happen with this. So all of the community groups that are interested in helping, we will hope that once we've got the hospital signed up, and please, the more you can do for your hospitals to sign up, the better state we'll be in with your areas. But we will be asking for you to join in. I'm sure there'll be a lot of outreach between the different orbs and the different community groups. We always have had people participating in webinars. One of our biggest strengths is our patient panels. Whenever we have a CHAMPS conference, we have a patient panel, and the patient panel talks about what their kind of experience was in the hospitals, and Kim always moderates those panels beautifully, so there's never any finger pointing, but there's definitely a lot of tears shed and resolutions made and empathy shared, and so we do that, and we look to community-based groups to find people to help work with us on those panels. You can also share information with other groups in your area that may or may not be aware of the program and help the orbs in their perspective. So most of it is hospital based, like we're on location or virtual sometimes, but some of the things we will do, and we have a couple of pictures here of our different trainings. And many of you will be familiar with Kathik or others, who is a big trainer in the breastfeeding world. And we have a whole sort of slew of trainers who are ready to go for this initiative. And they provide training and technical assistance on safe implementation of the 10 steps and QI. We also have on the team QI specialists. We have physicians. We have Dr. Winter from the AAP, and we also have Lorimer Ortiz from Puerto Rico, and we have Dr. Michelle Owens, who's an obstetrician in the South. We have a bunch of clinicians and nursing experts as well. Jennifer Ustianov is a nurse. All of them ready to jump in and do some training and coaching, all of which will be provided free of charge to the hospital teams. And we often loop the communities into those trainings as well. We will have a coach for each hospital and a TA rep. So the coach will be someone who's really an expert on the 10 steps, on hospital practices, who's kind of been there, done that, and knows what you guys in the hospitals need to do and how difficult it is. And then the technical assistance will be one of our team in Boston who will help, for example, when you're trying to collect the data, who will set up conference calls, meetings, liaise between the program and the hospital. So everybody will have someone who's representing them there to help with the data collection. We will have conferences for all the hospitals that are enrolled, and we will also provide site visits to hospitals to help overcome barriers that may be specific that can be best sorted out on site, like where in the medical record do we chart skin to skin? Is it the mom or is it the baby? We never thought of that before. Those kinds of things that come up when suddenly you start to look for the data or start to try and assess where you're at. We will have, first of all, an improvement team, a QI team, which we're calling the STEPS team at each hospital. So we need the buy-in from the hospital. We will also do a needs assessment for staff training and QI, because I know some of the hospitals are already very far on with QI, and others may have never done it before. We have spent a lot of time working with hospitals explaining what the PDSA cycles are. So we will assess the need for QI training in each hospital that signs up. One thing we learned from our previous experience is that it was very common for, leadership to be all aware of this and the nursing staff not to be. And that was something that in focus groups we did, the nursing staff said, things just were handed down, or suddenly one day we were doing something different and no one ever told us. So we will be making a communication plan. I will say that nursing was probably the keystone of everything in Mississippi. I mean, it was the nursing teams that took this on and went with it and helped everyone through the thick and thin of it. They were really the golden core of this. But we want everybody that's working the units to know what's going on. So we'll have a communication plan. Then we'll have a training curriculum. First thing we will be training about is safety. We're all aware that in order to be able to implement some of this work, you have to be trained how to do it safely. It's one of the areas we work in the most. And that is something we will emphasize right from the beginning. Then we'll do some basic breastfeeding training, and then we'll have the training modules. And then, as has happened in other places that we've worked, we've then progressed to train the trainer. Another mistake we made in one place where we were working was to start out with train the trainer, and then we realized that there weren't enough qualified people to be trainers because the basic information wasn't there. So we start with everybody training. And now in Mississippi, for example, we really only do train the trainer programs because the hospital staff has been trained in the basics, and the trainers want more specific information and be able to do it themselves. So that would be the sort of key of the goal, longer term goal of the training. You can all get started right now. The breastfeeding human medicine IPE, the interprofessional education unit, is something that we created in Mississippi in 2020. It is free. It's going to be the baseline core of the program. It's a 3-hour training. You can go in and out of it. You don't have to do it all in one go. This is me directing it. It was just I have to be very careful. This was like our opportunity in this thing. And anybody who knows anything about breastfeeding training in the hospitals will love this video. I just promise you'll love it, because it was our opportunity to highlight all the opportunities, as the nursing staff call them, all the opportunities for change and all the things we would really love to say to everybody all the time. And we had a bunch of actresses who were the moms who came up with all of your sort of common scenarios. We had all sorts of people. I promise you'll have fun with this training module. It's not like any other. So I would encourage anybody to sign up for it, but it will be the first thing that the hospitals do. And you go into a website, you sign up, and you can actually you can get CE credits for it. And a certificate of completion. So it's a basic 3-hour course, because the entire baby friendly thing has shifted away from what used to be the 15-hour course. That the WHO doesn't say that anymore. It's all about competencies, and you will be doing competencies as well. So I want to end the formal presentation there, because we have about 15 minutes left for questions. So that is what is coming out from Oz. I think I will stop sharing my screen at this point. And I don't know if Laura or anyone I see Kim Marie on there, anybody would like to talk about any of the questions. Laura or Kim, you've probably been monitoring everything. Do we have any questions that people have asked?
Well, I think Kim, I've been keeping track of things, but I think Kim had one person text her a question that's been answered in the chat, but I think it's good to just reiterate because it's hard to follow the chat sometimes. So, Kim, did you want to share that
Sure.
question?
So what was asked is, what happens if you get if you get 200 hospitals? They want to know if it would be extended. So
Yeah. And I
Oh,
answered,
Doris, I'm not going to ask Doris that question. I mean, honestly, guys, the funding is for 100 hospitals, right? I don't know. Did you answer the question, Kim? Did you have an answer?
I did not. I was waiting to
yeah, I
let
think
everyone hear it, because I think more than one would like to hear it.
yeah, I responded to Kim. And it's similar to your initial response too. Like the CDC has requested that oh, sorry, I said apply 100 hospitals, enroll. So that's the request that we enroll 100 hospitals. So I think like that would be up to the CDC to do more, but that's what we've been funded to do.
I mean, the bottom line answer is kind of no, like we're going to do it. I mean, that's the short-term answer. So yeah. Okay. Anything else, Laura, that you wish to
so some other questions have popped up. I'll just go through the chat. So one question, and Doris, this is a question that I said we'd have to field back to you. Someone asked if a hospital is participating in another study with the LACT tool, LACT tool, does that interfere with inclusion criteria for this study or program?
Okay, so I think we can't put anyone on the spot, but let's keep track of those kinds of things. I did see someone also asked about if you're baby friendly. This is also something we will have to consider. It sort of depends where you're at with baby friendly. I know we have quite a few hospitals in baby friend that have.
I think my response I did respond, like hospitals that are designated baby friendly by definition will have to adopt the 10 steps. So that's kind of like, that's the purpose of the grant, is to help hospitals adopt the 10 steps. But then you were saying, and there's many hospitals that maybe if baby friendly designation has lapsed, they're in a different situation where those practices aren't in place. But the purpose of this is really
one-on-one. We'll consider that one-on-one. Again, it's not something to really commit to at this point.
Right. And there's also one in about Empower, which would be about the same answer as you're saying now, because they have also been working through that.
Yeah. Okay.
Another person asked, please define the breastfeeding rates you will be using to select hospitals / reasons / regions. So that's like when we're enrolling hospitals. So, and then they said initiation, ever breastfed, or duration rates, exclusivity.
So the breastfeeding rate per se is not going to be a, in or out consideration. We'll look at the places that send us their interest, and there's no answer to that question. It's not an entry or not. I mean, if you've got a 90% exclusive breastfeeding rate, guys, probably it's not the right application for you. But beyond, we were working with hospitals that have lower rates. I mean, an exclusivity or initiation. I mean, there's a lot of places where they've got a really high initiation and really low exclusivity, which is a flag that something's not happening. If people have all started but nobody's made it out of the hospital exclusive, that's a problem. So there's no reason we would not enroll a hospital like that. But again, there's no one number I can give you.
And in terms of rate, like on the form where hospitals are going to fill out if they're interested, we are asking them about their rates in the hospital. So we're only asking hospitals to report their own rates. And so sorry. So that was, I'm just trying to make sure we go through all of these. And then someone asked, is the expectation that a facility becomes baby friendly?
So we have not set that expectation for this particular program, no.
Another question, this was asked by several people. So there are some states and areas that have hospitals that are in they're in a group together, there's systems, they share medical records, for example. Should they apply individually, or can they apply as an entity? I said that hospitals needed to apply individually, but we definitely want to work within systems.
Perfect. Yeah.
Mhm.
So identify on the form that you are part of a system. We'll be looking at that. Yeah.
Okay.
I'm seeing a question here, Laura. You're going to say about the average hospital size for, I'm assuming from the CHAMPS National, but in general, I mean, honestly, there's no average. We had very small rural hospitals. I'm sorry, from maybe this is about Mississippi. We had very small rural hospitals. Most of the hospitals, but not all, in the Indian Health Service were smaller. But Kim and I have worked with hospitals with 8,000 births as well. So there's no criteria for that. I would say that generally we want a mix. We're not going to enroll every hospital in Alabama and nobody in the north. We're not going to enroll, you know, that's yeah. I mean, all big or all little hospitals.
Mhm.
No criteria.
I
Did you
think
want
within that question,
Kim, did you want to say
Yeah,
something?
yeah. Well, there were just two that I wanted to get to
Yeah,
too.
go ahead.
Very quickly.
Go
One
ahead.
is someone asked about the IPE. Is it for providers? Absolutely. You can get CME credits. You just have to pay for them, but it's definitely worth doing. And there are no CERPs. Someone asked about those. And the other one was is there a conversation going on with hospitals and medical associations when you're talking about community? Definitely. We work very closely with the AAP and also the National Medical Association. And we're definitely start in the hospital talking about lived experience advisory groups. And that's why and how we started to bring in WIC with us immediately. So the community is also included in discussions with the hospital and the medical associations.
there was one question too from Q&A. I want to make sure we get to those.
Yes.
So there was a question about how this would apply to preterm babies and NICUs.
Yes. So I don't want to say it doesn't. We ask about the NICU, but most of the 10 steps are not devoted to the NICU. I would say it often has a spillover effect, especially in smaller hospitals. You know, we see that, you know, sometimes they share the nursing staff and things like that, but it's not specific to the NICU. You know, it's focused on the birthing process, the birthing hospital, and the healthy term babies.
Mm-hmm. Another question was, so sorry. Well, this is kind of a good question. Someone asked about like the 80% compliance rate. So it sounds like, you know, people on the call are aware of baby friendly. That 80% compliance rate comes from baby friendly designation. So are we looking, or will CHAMPS National be looking for an 80% compliance for each step? Or were we doing that kind of compliance?
Well, yes. Yes, we want that. We do want that. You know, without it being unrealistic for you guys to sort of meet and we're not going to measure every step necessarily at 80%. Again, what we found is if we work on rooming in and skin to skin, your breastfeeding rates go up. And the ultimate goal is to decrease the breastfeeding rate disparities and increase exclusive breastfeeding. So it is an 80% pass rate for each step, but to what extent we would police that, I'm not sure. You know, that's what the benchmark is. That was what the aim is. And before anyone asks, no, there isn't a requirement that have 80% exclusive breastfeeding. No, that is not part of the thing. There's also loads of very interesting. Go on, sort of broader picture.
There's another one. What's happening in areas in which there are families who need support, but they are not located geographically near a hospital. For instance, I think they're saying Mississippi is experiencing maternity care deserts due to closing facilities. And we are well aware of this because we work.
Yeah, you can answer that one, Laura.
We've seen that. Unfortunately, this program, this collaborative agreement does not address that issue, but I agree that it's a really important issue. I mean, in terms of like bringing care locally to the people, it's really a hospital based
but
issue. But
if you're a
yeah.
hospital that is serving a big rural population of people who have no access only to a hospital 50 miles away, please, being the hospital that is 50 miles away, mention that you serve a large birthing area, because that will help. Kim, did you want to say something?
I do. I'm sorry. I was just reading there's so many questions,
I know,
but
and they're really good.
I wanted to say hi, Dr. Lori Feldman Winter, and then there was a question. Oh gosh, I kept reading and I was trying to hold on to answer one, but I got into the other ones. I'm gonna have to turn off now.
So I see a few specific questions while you find it, Kim. A few specific questions like, what about those anesthesiologists? What about those doctors? What about, we have dealt, God, guys, there is nothing we haven't dealt with. Okay, so I'm not going to tell you now how to handle your anesthesiologists, but there's nothing we haven't seen. And every hospital always comes to us thinking that there's never been a hospital with that big a problem. And there has. So we help you through all of those bumps in the road. Kim, was the one you wanted to?
Yeah, I did. I just wanted to say to Gwen West from Washington, D.C., that I see your question, and we're going to answer that. We're going to work with you and talk to you about this because, of course, that hospital is very important to us too. So it's a question that D.C. has had for a little while, and we're going to work with that.
I see Doris has appeared. Did you want to say something, Doris?
I did want to say something. First of all, thanks for all these great questions. And I know that Anne and Kim and the team, Laura and the team will be working to get you answers to these questions and make them available to you. I also wanted to thank Anne and Kim and Laura and Mariah for making this such a successful webinar. I think they provided a lot of helpful information as your hospitals think through if this is a opportunity that you are interested in applying for and pursuing further. And I also just wanted to mention that collaborative piece about that is, I think there will be, as Anne said, usually if your hospital's having this problem, maybe another hospital is or has. And so you'll learn from each other as well. And that's one of the big benefits of this kind of work, is that you're not only going to be learning from really experts and getting technical guidance from the experts in the field, but you'll learn from each other about what does seem to work well in the real life setting. So you all have some expertise to offer as well for the program, and we really hope that you will consider applying for it and providing that expertise across the board.
Great note to end on. Thank you. So do not panic. We will send out the application form to everyone who's registered for this webinar, ideally by the end of the week. It will be an expression of interest. It's a very broad form, and then we'll review them. And I really don't know if we're going to get 50 or 500. I really don't know, but please get them in. We will make them accessible. We will also be opening up a page on the CHAMPS Cheer website as soon as Laura and I have had a chance to read all the great work that Mariah's been doing on that. So things will be coming up very soon. I think we've already hit the ground running. You know, we've had this less than a month really, and we're already going wild. So thank you everybody for your participation. I think my team, can you keep track of everything that's in the chat there, so that if there are unanswered questions, we can get back to them? We'll probably put some of the most frequently asked questions on our website with answers to your questions.